All right, here's a video for you. If you're on there, doing what I did and trying to find something about the L3-L4 spinal fusion on a workman's comp case, this is for you. That's what I'm going through. I have a bulge in my L3-L4, and it happened at work. So this is not insurance, it's a workman's comp deal, which is terrible because they just drag their feet with everything. So if you're going through this, I'm sorry. I look forward to a long road. They are not quickly or timely about anything that they do. So just a little catch up. It's been almost, or actually over a year since I actually hurt my back. And at the beginning, I took off work, went and seen a primary care physician who did x-rays, but said that I would need an MRI, which they could not do. So workman's comp got it set up. It was, good month or two before I could get the MRI done. And they found out that I had a bulge disc, and they set me up with a doctor who basically prescribed physical therapy. That's always the start. I've had a couple back surgeries, and they always begin with physical therapy. And for me, physical therapy actually made it worse. Every day, just my back hurt even more. They tried to take it easy and do things easy with me, but just everything was just, making it worse. So I think I did that like maybe 6 to 8 weeks, and then they finally stopped doing that because it was just making it worse. So then they set up spinal injections, which is where they inject like a cortisone or, something in there to try to help, kill the pain. And I think they did 3 injections on me, and it did not work. None of them did, not even a little bit. I had them injections in the past, and they helped me in the past for like a couple weeks or so, and then the pain just came back. But this time around, they didn't help at all. So they finally sent me back to the doctor, and it's quite a while later before I finally seen the doctor again. Everything again just takes forever for them to approve it. It's definitely in your best interest to get an attorney. I finally did because, they just wasn't doing anything. I needed somebody to, put some fire under them. And so anyway, I went back to see the doctor, and they really was kind of almost like had an attitude about it. He was like, well, this doesn't sound good at all. Nothing about this is good. And then he just leaves the room. And he finally comes back, and tells me that, basically he doesn't think that I'm a good candidate for surgery, and that it's in our best interest that we get a second opinion. So I was like, wow, it was really a lot to take in because, after all this time, I was really hoping that, they just, fix me like they did in the past. And he was making it sound like I wasn't getting fixed, and also had an attitude about it. But so I went to see a second doctor, and this guy was younger and a lot nicer. He also told me he wasn't a work comp doctor. He was just, regular doctor or whatever, which is a good thing because I don't know if you know, but it makes sense. Them workman's comp doctors, they get paid to, cut cost and to keep things minimal. They're not trying to give you the best treatment that you deserve. So I got lucky enough to get this other doctor, and he told me, thought I was a good candidate to have this. He wants to do minimally invasive fusion on me, which he thought would be really good for me. But he wanted me to go have another scan done. I can't think of what the heck it was called. Basically, it's a scan where they inject you with like a radioactive sort of stuff, and then like an hour later you come back and they have this machine that rotates around you. And basically, tells you where, or helps narrow down where the pain is concentrated around. So I had the scan done, and they screwed the scan up. They did it wrong, so I had to go back and have it done a second time. And of course, there's like a month in between. Everything takes a long time. But I had the scan done and went back to the doctor, and he found out that I have Spondylolithises, which is where your vertebrae or one disc falls forward, down on top of, or in front of another disc, because of the lack of support back there. I also have bilateral pars defects, which is fractures on both sides of that little bump you can feel in your back. That's basically free floating back there. It's broke on both sides. I mean, there's muscles and stuff that kind of hold it there, but there's no bone holding it there. It's just, floating. So it makes sense why the spondylolithisis, why my disc would fall out of place, because there's not the support there that should be. But again, that was just like, wow, there's more wrong back there than what we thought. A lot of sleepless nights, no medication. At the beginning, the first doctor that I seen, he did prescribe me with tizanidine and cyclobenzaprine on different occasions. But I told him neither one of those were helping me. I've had several surgeries, a lot of injuries, and my tolerance ain't there. I've had a lot of different medications. And I don't know, they weren't having it. She just basically told me it wasn't, she could give me something else, but, it was not as good as what they were giving me or something. I don't know. It was the receptionist lady, the main lady at that doctor's office was very pissy on the phone and in person. She just hated her job or something. I don't know. I really got the short end of the stick when it came to that particular doctor's office. But, the new doctor seems to be a lot nicer. But again, no medication. I just, it's painful every day, sleepless nights. I get like maybe 10, 15 minutes of standing before it just, shows right up. I got like bend over, like stretch it, or it's just very uncomfortable. I'm really so tired of dealing with it. And I was really anxious to get this ball rolling and get the surgery, surgery date, started anyway. And now that I know it's going to be November 29th, it's kind of a little nerve-wracking, I guess. You don't just wake up feeling better. Some people, based on the research that I've been looking up, some people get up and walk right away, and some people wake up in the worst pain they've ever felt. So everybody's different. We don't really know what to expect. But I guess it's better than it not getting done at all. So I don't know. I'm just tired of being in pain. Tired of not being able to sleep in bed. It's not very fun. So anyway, workman's comp, very long process. If you're going through this L3-L4, stay tuned. We'll see how mine goes. And it's going to be different than, I had the L5-S1 fused 7 years ago. And they cut my stomach open and my back open to do that surgery. And that was pretty terrible. They cut through all the muscle back there. And this time they're supposed to do the minimally invasive, where they go like through my sides or something. So it shouldn't be as bad. Shouldn't be. And I'm hoping that that's true. So Again, if you're going through this, I wish you the best of luck, and hopefully this has helped out a little bit. You know, comment below. I'll respond, you know, with any information that I have that might be able to help you out. Because I know that I look up everything on YouTube trying to get answers. That's how I fix a lot of stuff, is by YouTube. And for some reason, there ain't a whole lot about L3-L4 fusions on here, let alone ones that have been going through the workman's comp side of it, because that's way different. They just do not give a damn about you. So I care.